what we're suggesting then is that perhaps 5 million people a year are getting blood with the assumption that it's helping them, and in some, if not many cases, it may even be hurting them. The answer really lies in a new understanding that it is not how much oxygen is carried by a red blood cell or by the blood, but rather by how well that blood can open up a blood vessel and get the blood or get the oxygen to the tissue. If blood can open up blood vessels, the oxygen will get to tissues. Hearts will be supplied with adequate oxygen, the brain will get adequate oxygen, patients will do well. If red blood cells cannot open up blood vessels, the oxygen will not get to the tissues in need of oxygen, regardless of how much oxygen they carry. So now the question arises as to why bank blood is different from the blood in our bodies. And one answer appears to be that our blood loses a critical gas called nitric oxide, whose responsibility is to keep those blood vessels open. So in effect, stored blood does not have the ability to open blood vessels. Unlike our blood, which is opening blood vessels, dilating blood vessels, making sure that blood flow is improved to organs in need, such as the heart and brain, blood in blood banks is not able to do this. And consequently, we give blood, but we do not improve blood flow. What happens then is that those red blood cells effectively plug up blood vessels that they would normally be dilating. So instead of helping, they end up hurting. They end up sticking to the blood vessels and blocking blood flow. The solution, we think, to the problem is to put back the nitric oxide that is deficient in our bank blood. And we've worked out now a way to do this. And we have put back the nitric oxide that is quickly lost, and we have infused that blood back into animals, and sure enough, it then opens blood vessels and it improves flow to tissues that are in need of the oxygen, in need of the blood, so to speak.
Heart surgery often means a blood transfusion, but after large studies link transfusions to a higher risk of heart attacks and death, a growing list of hospitals is changing their procedures to dramatically reduce the use of stored blood. Virginia Commonwealth University anesthesiologist Bruce Spiess has led the effort, but he says even the medical community has trouble accepting that blood may carry more risks than previously thought.
We've never taken it to the rigorous tests that every other medical therapeutic has to be put to. And so it's just largely been a belief system, almost a religion, if you will, that if you give a unit of blood, patients will get better.
Now researchers at Duke University have figured out why banked blood might not do what it's supposed to do, carry oxygen to tissues. Jonathan Stamler and his team show that while stored blood has just as much oxygen as fresh blood, it quickly loses another gas, nitric oxide, which expands blood vessels. Lab tests showed that banked blood didn't just fail to open blood vessels, it closed them.
It sucks up the nitric oxide from the tissues and leads to blood vessel constriction. And constriction of blood vessels means decreases in blood flow, absent blood flow, which may be the cause of the heart attack.
As they wrote in Proceedings of the National Academy of Sciences, they developed a simple way to add nitric oxide back to stored blood. Tests in animals indicate it works.
When the blood is infused into animals, those animals then get oxygen properly.
Stamler hopes offering a solution will improve the safety of blood, what he calls a national treasure. I'm Brad Closa.
Blood that has been stored for over 4 weeks carries an increased risk for infection. Researchers at Cooper University Hospital in New Jersey studied over 400 patients who received a blood transfusion while in intensive care. They found the older the blood a patient received, the higher their risk for infections like pneumonia, upper respiratory infection, and sepsis. For example, patients who received blood 29 days or older had double the risk for infection. Experts say the longer the blood is stored, the more biochemical changes take place, some of which weaken the immune system. Current regulations say blood must be discarded if it has been stored for 42 days.